So we can start the 17th page. Okay. ऊर्ध्व गुदा का वर्णन अष्टांग संग्रह में मिलता है. So ऊर्ध्व गुदा, okay, ऊर्ध्व गुदा, that part has mentioned by Ashtanga Sangraha. Okay, he has mentioned urdhva guda, that type of parts are there. Otherwise charaga sushruta, they are telling only guda pradesha. Okay, so there is a division of guda, that is urdhva guda, that is mentioned. The description of urdhva guda you can find in the Ashtanga Sangraha. Then sabse prajina samhita, like modern samhita is Sharapani Samhita. Okay, sabse bedi samhita is Brahma Samhita. The very large samhita is Brahma Samhita. Okay, modern samhita is Sharapani Samhita. Large samhita is Brahma Samhita. Then चिकित्सा में विषों का उपयोग का वर्णन सर्वप्रथम वाग्भटा में आया है. So विषा, okay, विषा प्रयोग in चिकित्सा, like in स्थावर विषा we can use जांगम विषा as a treatment. In जांगम विषा चिकित्सा we can use स्थावर विषा as a treatment. Okay, that is called प्रति विषा प्रयोग. So this type of चिकित्सा क्रम is first of all described by वाग्भटा. Okay, for if a person has got Stavara Visha Lakshana, you can give Jangama Visha as an antidote. In the same way, those who are suffering with the Jangama Visha, then we can give Stavara Visha as an antidote. So that type of Chikitsa Krama, first of all, it is mentioned by Vagbhata. Then Ayurveda Panchanana, that is that title is given for the Jagannatha Prasada Shukla. Then Arvachina Kalaki Andima Samhita. Okay, so the modern times, the last Samhita. Okay, the last Samhita in the modern time, that is Ayurveda Vijnana. Then Ashtanga Sangrahakara Rasa Vriddhi se Sleshme Vigaro ki evam Rekta Vriddhi se Pittaja Vigaro ki Ulpatti mante hai. So according to Ashtanga Sangraha, because of the Rasa Vriddhi we will be getting Kafaja Vigaras, and because of the Rekta Vriddhi we will be getting Pittaja Vigara. So that type of quotation is told by Ashtanga Sangraha. Okay, if you are getting Rasa Vriddhi, so it leads to Kafaja Vigara. If you are getting Rekta Vriddhi, it leads to Pittaja Vigara. वाग्भटा धातुओं में विशिष्ट दोषों की उत्पत्ति मानते हैं. सो वाग्भटा इज टेलिंग फ्रॉम द धातु दोषास आर ओरिजिनेटिंग. ओके, सो एग्जांपल दैट इज फ्रॉम अस्थि धातु वायु दोष इज गेटिंग. रक्ता एंड स्वेद फ्रॉम दैट पित्त दोष इज ओरिजिनेटिंग, एंड रेस्ट ऑफ द अदर धातुस फ्रॉम दैट कफ दोष विल बी गेटिंग. Like Ashraya Ashrayi Dhadu. Okay, from Asti it is Ashraya to Vayu Dosha, Rekta Sveda is Ashraya to Pitta Dosha, and rest of the other Dhadus are responsible for the formation of Kapha Dosha. Okay, this is the way how the doshas are forming in the body from the Dhadu according to Vagbhata. Okay. Then Suvarna Dviba. Okay, Suvarna Dviba, that is it is a word which is used for Malaysia. Okay, so for Malaysia, Suvarna Dvib, that one term is there. Rekna Dvib, that is called for Sri Lanka. Okay, because in Sri Lanka so many Reknas we used to get, no? So that's why it is called as Rekna Dviba. Malaysia is known as Suvarna Dviba. Then चाय के लिए श्याम पर्णी शब्द का प्रयोग आया है आयुर्वेद विज्ञान. So in Ayurveda Vijnana textbook, for chaya he has mentioned the term Shyama Parni. Okay, so Shyama Parni is indicating chaya in Ayurveda Vijnana. Then Pajana Krama in Agni, like how the digestion is happening. So first of all Jadarakni will be acting, then later onwards Bhudakni, then Dhatwakni. So if you are eating the food, first of all Jadarakni will be acting, then later onwards Bhudakni, then after that Dadwakni will be acting. So this is the way how the Agni will be functioning in your body. Then Prakrita Rasa and Varna of Doshas. This is also important. Okay, so Prakrita Rasa of Vada Dosha is Kashaya. Okay. The normal rasa of Vada is Kashaya rasa, and normal Varna is Avyakta Varna or Shyava Varna. Okay, there will be no color, or otherwise Shyava Varna, blackish discoloration. So that is all indicating the normal color of Vada dosha. Pitta Prakrita rasa, the normal rasa of Pitta is Katu. Okay, normal rasa of Pitta is Katu. Normal Varna is Pida, yellow discoloration. Okay, yellow discoloration, that is indicating Pitta dosha. Okay, that is a normal color of Pitta. Then prakrita rasa of kapha dosha is madhura. Okay, madhura rasa, the sweet taste is, it is indicating kapha dosha. And the normal varna is shveda. Okay, white discoloration. So wherever white discoloration you can see, that's are all indicating kapha dosha. Wherever you are seeing yellow discoloration, that is indicating pitta dosha. Wherever you are getting shyama varna, which means like a blackish discoloration or brown discoloration, these are all indicating vada dosha. Okay, kashaya rasa is the normal rasa of vada. Katu rasa is the normal rasa of pitta. Madhura rasa is the normal rasa of kapha. Okay, and Vigrudha rasa. Vigrudha rasa of vada dosha is katu. Okay, Vigrudha rasa of vada dosha is katu. Vigrudha rasa of pitta dosha is amla. So that's why amla pitta. Okay, amla pitta disorders, why, what is happening there is pitta vidagdha is happening. There is a pitta dosha malfunctioning is happening. So that's why amla pitta, that sore, belching, that type of symptoms you are getting. So amla rasa, that is always indicating there is some vitiation has happened in the pitta dosha. Okay, so pitta vidagdha, so pitta vigruddhi is happened. So that time you will be getting amla rasa. Kapha Vigrudha rasa is Lavana rasa, very very important. Okay, so if Vigrudha rasa of Kapha is Lavana rasa, Pragrudha rasa of Kapha is Madhura rasa. Okay, if they are asking a Vigrudha rasa of Kapha, so we will get confused. We always will go and opt the option Madhura rasa. So it is actually Pragrudha. Normal taste of Kapha is Madhura, and Vigrudha taste of Kapha is Lavana rasa. Okay, that is very important. And in Vada also normal rasa is Kashaya, Vigrudha rasa is Katu. Okay, Pitta Pragrudha rasa is Katu, Vigrudha rasa is Amla. Okay, then synonyms of Triphala. Phalatriga, Vara, Sreshta, Uttama, these are all synonyms of the Triphala. Okay, so don't get confused. So Phalatriga, Vara, especially Vara we used to get the term. So Vara, it is always indicating Triphala. Okay, then Amrita Sambhava, that is a synonym of Amrita. Okay, that is mentioned by Dhanvantari Nigandu. So Dhanvantari Nigandu, in that you can see Amrita Sambhava, that is indicating Amrita. Kabi Pippali, that is a synonym of Apamarga. Then Grahani Hara. Okay, so the Grahani Hara, it is a synonym of Lavanga. Okay, so Lavanga is Grahani Hara. So these synonyms is very very important. Sometimes they used to ask. Okay. Then for congestive heart failure, CHF, congestive heart failure, for congestive heart failure we can give Karavira and Digitalis. Okay, Karavira, Digitalis we can give for congestive heart failure. Ischemic heart disease, IHD. Okay, ischemic heart disease, for that Arjuna, Amrita Kalasha, these type of drugs we can give. Then congestive cardiac failure, CCF, congestive cardiac failure, for that Karavira is indicated. So these are the drugs we can give for the particular heart disorders. Then for hyperlipidemia, Leshuna is indicated. Leshuna, garlic. Okay, so garlic is indicated for the hyperlipidemia. Then Sreshta Vayu. According to Charagan, according to Vakphata, Sreshta Vayu is Prana Vayu. But according to Sushruta, Sreshta Vayu is Udana Vayu. Okay. Then Renjaga Pitta Sthana. Okay, according to Vakphata, Renjaga Pitta Sthana is Amashaya. According to Sharangadara, Renjaga Pitta Sthana is Hridaya. According to Sushruta, Renjaga Pitta Sthana is Yakrit and Pliha. Okay, Renjaga Pitta function is to give the color. Okay, Rase Renjanath. Okay, Renjaka Pitta, its function, main function is it is giving color to the rasa. So it is located in Amashya according to Vakphata. According to Sharangadra, it is located in Hridaya. According to Sushruta, it is located in the Yakrit and Pliha. Then Hridroga Karana. Okay, reason for getting Hridroga is Rasadushti. Then Ridukala mein sharir ka bhar badta hai. So during the Ridukala, the weight will increases in your body. Then Ulbaga Roga, so that we can correlate with the aspiration pneumonia. Ulbaga Roga, it is a neonatal condition. Okay, so after the delivery of the baby, so the baby will be aspirating the amniotic fluid. Okay, baby will aspirate amniotic fluid and it will get obstruct in the throat area. Due to that, the baby will be suffering with the breathing difficulty. That type of condition will be generating. So that is called Ulbaga Roga. So in the modern, we can correlate with the aspiration pneumonia. Okay. So a baby is sucking the amniotic fluid during the delivery time. Okay. So vulva we can correlate with the vernix caseosa. After the delivery we can see there will be small layer you can see in the baby's body. Okay. There is a thin layer will be there like a fluid type of layer. So that is called vernix caseosa. Then Trivida Pariksha. So Trivida Pariksha, it is mentioned by Charaka and Bhava Prakasha. Shadvida Pariksha is told by Sushruta. Ashtavida Pariksha is told by Yoga Ratnagara. And Dashavida Pariksha is told by Charaka. So Charaka, Dashavida Pariksha, Trivida Pariksha has mentioned. Sushruta has mentioned Shadvida Pariksha. Ashtavida Pariksha is Yoga Ratnagara. Okay, so we'll see which are the parikshas. So Trivida Pariksha, you can see according to Vakphata, Darshana, Sparshana, Prashna, that is the Trivida Pariksha. According to Charaka, Aptobadesha, Pratyaksha, Anumana. So these are the Trivida Pariksha according to Charaka. Aptobadesha, Pratyaksha, Anumana. Okay, Aptobadesha means we are receiving the knowledge from the Guru, okay, from the teachers we are receiving, so that we are analyzing Pratyaksha, what you are observing, what you are seeing in the patient's body. Then Anumana, then we are interpreting the condition, whatever the teacher has told, whatever you have seen, and accordingly you will be interpreting all those things. So through that way we will be identifying the Roga. Okay, this is the Trivida Pariksha according to Charaka. Aptobadesha, Pratyaksha, Anumana. Chadurvida Pariksha. According to Charaka, Aptobadesha, Pratyaksha, Anumana, Yukti. Okay, so Yukti it is told by Charaka. The same thing is Sushruta is also telling Aptobadesha, Pratyaksha, Anumana, but instead of Yukti he has mentioned Upamana. Okay, so this is a Chadurvida Pariksha according to Charaka and Sushruta. Shadvida Pariksha, very very important, that is told by Sushruta, that is Panjendriya Pariksha plus Prashna Pariksha, that is Shadvida Pariksha. Okay, so Shadvida Pariksha is told by Sushruta, that is an important point, that is Panjendriya Pariksha plus Prashna Pariksha. Then Ashtavida Pariksha, that is told by Yoga Ratnagara. Which are the Ashtavida Pariksha? Nadi, Mutra, Mala, Jihva, Shabda, Sparsha, Drik, Agriti. These are these 8 things if you are examining, that is for the diagnosing of the disorder. So that is called as Ashtavida Pariksha, which is told by Yoga Ratnagara. Okay, most of the time we can get question Nadi Pariksha is introduced by which Acharya. Okay, so Yoga Ratnagara is the has mentioned about Ashtavida Pariksha and Nadi Pariksha. Then Dashavida Pariksha, which is told by Charaka. Okay, so Prakriti, Sara, Samhanana, Vikriti, Pramana, Satmya, Sattva, Ahara Shakti, Vyayama Shakti, Vaya. These are the 10 things we have to examine. Okay, so Prakriti, Garbhaja Prakriti, Jadaja Prakriti, and then Sara, okay, Ashtavida Sara, like Tok Sara, Rekta Sara, Mamsa Sara, like that we have studied, no? That one. Ashtavida Sara, Samhanana, Stula, Madhyama, Krisha, like compactness of the body. Okay, so based on that Stula, Madhyama, Krisha, we have to write. Then Vigridi, Lakshana Nimitta, Lakshya Nimitta, Nimittanurupa. Okay, then Pramana, Sharira Anga Pramana, all body parts are there properly. If there is extra growth is there, or if there is one of the part is missing, okay, that type of all the things we have to mention in the Pramana Pariksha. Then Satmya, Desha Satmya, Kala Satmya, Ahara Satmya, Oga Satmya, these are all we have to examine for the Satmya. Then Sattva, Pravara Madhyama, Avara Sattva. Then Ahara Shakti, Abhyavarana Shakti and Jarana Shakti we have to analyze. Abhyavarana Shakti means how much that person can have the food. Okay, some people they will eat only 2 chapati, but some people they will eat 4 or 5 chapati at a time. So that is different. Abhyavarana Shakti is different for 2 people. Right. So Abhyavarana Shakti means how much they can have the food. Okay, Jarana Shakti means digestive power. Okay, by which time the digestion will be completing. For some people it will take within 2 hours digestion will complete. For some people it will take 3 or 4 hours it will take. Okay, so Jarana Shakti, digestive power. Abhyavarana Shakti means how much they can have the food. Okay, so based on that we have to analyze the dosage of the medicine. So that's why Ahara Shakti is important. Then Vyayama Shakti, then Vaya, at what is the age of the person. If it comes on children or maybe middle age or maybe young age or it is an old age person. So like that we have, accordingly also we have to make the dosage of the medicines. Okay, and some disorders will affect only particular age also. So like that all the things we can analyze through the age. So these are the Dashavida Pariksha. Prakriti, Sara, Samhanana, Vigridi, Pramana, Satmya, Sattva, Ahara Shakti, Vyayama Shakti, Vaya. So these are the 10 things we have to examine. So this is told by Charaka. Next one is Taila Bindu Pariksha. That is also told by Yoga Ratnagara. So Yoga Ratnagara has introduced Nadi Pariksha and Taila Bindu Pariksha. So Taila Bindu Pariksha means we will be collecting the urine, and then in that urine we have to put a drop of oil. Okay, and then oil, how it is spreading, in which direction it is spreading, or if it is attaining particular shape, and according to that we can make the sadhya sadhyad of the condition. Okay, if a person is suffering with some disorder, if the disorder will cure or not, okay, if it is a sadhya or asadhya, or it is a kritra sadhya condition, for analyzing all those things we can do Taila Bindu Pariksha. Okay, so we will be putting one drop of oil into the urine, and what are the shape that Taila will be attaining, or otherwise in which direction this Taila is moving. Okay, according to that we can make the prognosis of the condition. Then Rogaha Sarve Abhi Mandakno. So that quotation is told by Vagbhata. So all disorders are happen because of the Mandakni. Then Trivida Kriya Kala, that is mentioned by Charaka. Shadvida Kriya Kala is mentioned by Sushruta. Very, very important. Shadvida Pariksha, Shadvida Kriya Kala, these are all told by Sushruta. Shadvida Kriya Kala, it is Sanjaya, Pragopa, Prasara, Sthana, Samshraya, Vekta, Bheda, that 6 things. Okay, through the 6 pathway only the disorder will be getting in your body. So in Sanjaya, accumulation of dosha will be there. Prakopa, it will be aggravated. Then Prasara, the aggravated doshas will be started to spreading all over the body. Then Sthana Samshraya. So Sthana Samshraya, here what is happening, dosha will be that aggravated dosha which is spreading, they will go and accumulate in the particular wherever the wherever the Kha Vaigunya, wherever the weak point is there, in that particular area this aggravated dosha will go and accumulate there. Okay, Sthana Samshraya, Vyakta, there in that condition you will be started to getting the Purva Rupa. Okay, Purva Rupa Roga Lakshanas will be started to occurring in the Vyakta, and in the Bheda Avastha you will be getting which dosha condition will occurring, like Vadaja predominant condition, or Pittaja predominant condition, or Kaphaja predominant condition, or this is Sannipadaja, like that all the things we can get in the Bheda Avastha. Okay, so these are the Shadvida Kriya Kala, how the disorder is happening in your body, that is explained in the Shadvida Kriya Kala, that is mentioned by Sushruta. In which chapter? Vrana Prashniya Adhyaya. Then Brahmana Chikilsa, it comes under the Shamana Chikilsa, that is mentioned by Vagbhata. Then Kashyapa has considered Ama, in comes under the Kaphaja Nanatmaja Vigara. Okay, like Nanatmaja Vigara is Vigaras are there. Nanatmaja Vigara means this like a particular condition is happened because of the particular dosha. Okay, like Nanatmaja Vigaras we have studied. For Vadaja 80 Nanatmaja Vigaras are there. For Pittaja 40 Nanatmaja Vigaras are there. For Kaphaja 20 Nanatmaja Vigaras are there. So because of this dosha only this condition will be arising. So that is called Nanatmaja Vigara. So due to Vada dosha 80 such disorders will be happening. For Pitta dosha 40 Nanatmaja Vigaras are there. For Kapha dosha 20 Nanatmaja Vigaras are there. So Kashyapa has included Ama. Ama is happened because of the Kaphaja Nanatmaja Vigara. Because of Kapha dosha only you are getting Ama. Okay, so that's why Ama is considered as a Kaphaja Nanatmaja Vigara. That is told by Kashyapa. Then Pradishyaya evam Kasa किस धातु की दृष्टि होती है? रसा. Okay, due to rasa दृष्टि we are getting Pradishyaya and Kasa. Then Rekta Pitta, in Rekta Pitta which Pitta Dushti we are getting? Ranjaga Pitta. Okay, because of the Ranjaga Pitta Dushti we are getting Rekta Pitta. Then Pandu, okay, that is because of the Sadhaga Pitta. Okay, because Rekta Pitta, Pandu Roga, these are all Pitta Dushti conditions. So in Rekta Pitta, Ranjaga Pitta is getting vitiated, and because of that you are getting Rekta Pitta. In Pandu, Sadhaga Pitta is getting vitiated. Then the next line, it is not much important. Then Adha Roga Adhikaram Dhanvantarinam Kriyavido. This quotation is mentioned in Charaka Samhita Gulma Chikilsa. Okay, in Gulma Chikilsa you will be getting this quotation. Adha Roga Adhikaram Dhanvantarinam Kriyavido. So which is meaning means this condition, okay, Gulma, this condition has to be treated those who are well versed in the Ayurveda. Okay, Dhanvantarina means those who are well versed in the Dhanvantari school of thought. Okay, which means those who are well versed in the Shodhana karma, those who are well versed in the Shalya karma, those who are well versed in the Siravyada, this type of people only should treat Gulma. Okay, so Adha Roga Adhikaram Dhanvantarinam Kriyavido. So those who are well versed in the Ayurveda, that person only should treat Gulma Roga. Okay, so this is mentioned in Charaka Samhita in Gulma Chikitsa. Then next one is Vada Vyadi Kshadakshina. In these two conditions you don't get Purva Rupa. Avyakta Purva Rupam you can get in Vada Vyadi and Kshadakshina. Kshadakshina is due to trauma you are getting, due to the accidents you are getting the condition. So before getting the accident we don't get any Purva Rupa, no, directly we are getting the Lakshana. So that's why in Kshadakshina you can't get Purva Rupa. In Vada Vyadi also there is no Purva Rupa. Okay, Avyakta Lakshanam Tasyam Purva Rupa Midi Smridam Shadakshina, Avyakta Lakshanam Tesham Purva Rupa Midi Smridam Vada Vyadi. So in both the conditions, Purva Rupa is Avyakta. Then Chakrapani ne Oja ko Ashtama Dadu kaha hai. So according to Chakrapani, Oja is considered as a 8th Dadu. Then Hema Churna Prayoga is indicated in Vishanashanartha. For the Visha purpose, we can use Hema Churna, that is mentioned by Charaka. Then Muktadya Churna, that is indicated for Shvasaroga. Then Mandra ka Sambandha Brahma se. So Mandra is coming from the Brahma and Tantra is coming from the Shiva. Okay, Tantra ka Sambandha Shiva se hai. Then Shukrayadam Balam Pumsam. So this quotation is told by Vaishajya Ratnavali. Agni Moolam Balam Pumsam Redo Moolam cha Jividam. That is told by Yoga Ratnagala. Okay, so Vaishajya Ratnavali is telling because of the Shukra you are getting the Bala. Okay, according to Yoga Ratnagara, Agni Moolam, because of the Agni we are getting the Bala, and because of the this Redo Moolam cha Jividam, because of the Redas you are getting the Jivida. Okay, life you are getting because of the Reda, because of the Agni you are getting the Bala. Okay, so that type of quotation is told by Yoga Ratnagara. Then Gardhabasti Bhasma, that is indicated for Shvitra, for the Lebana purpose. Okay, Gardhabasti Bhasma Prayoga, it is indicated for Shvitra. Gajasti Bhasma Prayoga is indicated for Ashras. Okay, then Charagane Dvaja Bhanga ka, Susrudane Upadamsha ka, evam Madhavane Viranga Roga ka Varnan kiya hai. So Charaga has mentioned Dvaja Bhanga. Dvaja Bhanga means we can correlate with the erectile dysfunction. Okay, so Dvaja Bhanga is introduced by Charaka. Upadamsha is introduced by Susruda. Okay, like a gonorrhea condition. Okay, then Madhava has introduced Firanga Roga, syphilis. Okay, so Charaga has mentioned Dvaja Bhanga, Susruda has introduced Upadamsha, Madhava has introduced Firanga Roga. Then Aupasargika Meha is there, that is mentioned by Vaishajya Ratnavali. Then Bahya Shrodas, it is also known as Malayana. Okay, in Bahya Shrodas, Mala used to get deposited, no? So that's why it is also known as Malayana. Then Arvajina Mada Anusara Kula Peshi Sankhya. So in in the modern times, the number of Peshi is 639. Okay, number of Peshi in modern, according to the modern medicine, that is 639. Then Ashtanga Hridayagara ne Marmo ka 6 pragar bataya hai. So like I have told you, in the Marma, based on the Adhishtana, Mamsa, Sira, Snayu, Asti, Sandhi, like that I have told the Adhishtana. Then additionally one thing which is told by Vagbhata, that is Dhamani Marma. Total 9 Dhamani Marmas are there. Okay. Next one is Agni. So 13 type of Agnis are there according to Charaka. So how it is distributed? Jadaragni 1, Bhudagni 5, Dhatuvagni 7. So like that 13 Agnis are there in our body. According to Susruta, Doshoki Agni. From the Dosha you are getting Agni, that is 3. Dhatu, from the Dhatu you are getting Agni, that is 7. From Mala also Agni is there, that is 3. So like that totally 13 will be coming. Okay. Next one is Swara Bheda Vyadi Evam Lakshana Dono hai. So Swara Bheda, as a disorder also you can get Swara Bheda, as a Lakshana of the disorder also you can get Swara Bheda. In both the ways you can get Swara Bheda. Okay, Swara Bheda, hoarseness of voice. Okay, so hoarseness of voice, as a symptom you can get. Okay, in Shvasa, in Kasa, in that conditions as a symptom you can get Swara Bheda. Okay, with as a disorder also we can get Swara Bheda. In both the ways you can find Swara Bheda. Okay, then they have mentioned one table in that Vada Rekta. So Vada Rekta, mainly which doshas are getting vitiated? Vada and Rekta dosha. Which are the dhadus are getting vitiated? Tvak, Mamsa, Rekta. These three are getting vitiated. And where it is occurring? Tvak, Mamsa, Sandhi. In these are the location of Vada Rekta. Then how the pain of Vada Rekta? Aku Vishake Saman. Very, very important. Okay, Aku Visha Samana Lakshana, where you are getting Vada Rekta. Aku Visha means rat poison. Okay, when the rat is biting or when the rat poison is entering in your body, how much pain you are getting, that much pain you can feel in the Vada Rekta. Okay, that is very, very important. Aku Visha, they can ask in the exam. So, Aku Visha Samana, that Lakshana you are getting in the Vada Rekta. In Ama Vada, which are the doshas are getting vitiated? Vada and Ama. Which Dhadu is getting vitiated? Rasa. Where it is, this Ama Vada is happening, that is in Sandhi Pradesha. In Ama Vada, which type of Vedana you will be getting? Vrishchiga Damshavat. Okay, Vrishchiga is biting, so that type of pain you will be getting in Ama Vada. Okay, so that too pain is very important. Aku Visha, Vada Rekta, Vrishchiga Damshavat Pida you will be getting in Amavada. Next one is Urustamba. So here Tridosha and Ama dosha is getting is the responsible dosha, and it is vitiating Medo Dadu. It is happens in the Uru thigh region. Okay, stiffness of the thigh is Urustamba. So in Uru Pradesha, this Urustamba is happening. Sandhi Vada, dosha responsible is Vada, Dusha is Sandhi, and Adhisthana is Sandhi. Then Kroshtuga Shirsha. Okay, here Vada and Rekta both are getting vitiated, and Rekta Dhadu is getting vitiated, and it is located in Janu Sandhi. Okay, so Kroshtuga Shirsha, what is happening means, because the Sandhi will be looking like a head of the fox. Okay, head of the fox, F-O-X. How the fox head is there, in that way the Sandhi shape will be coming. So that is called Kroshtuga Shirsha. So responsible dosha is Vada and Rekta. The Dhadu which is vitiating is Rekta Dhadu. Then Purusha Guna, according to Charaka 22, according to Sushruta 16. Then Snayuga Roga description you can get in Vrinda Madhava. Snayuga Krimi is mentioned by Sharangadhara. Okay, Snayuga Roga, it is told by Vrinda Madhava. Snayuga Krimi is told by Sharangadhara. Then Kaliyaga Shabda, that is indicated for Agni Ashaya. Okay, Kaliyaga, that term is used for Agni Ashaya. Kala Khanda, that is used for the Yakrit. Okay, Kala Khanda is Yakrit, Kaliyaga is Agni Ashaya. Then Kashyapa ne Sarva Pradama Ojuko Pancharasa Kaha hai. So according to Kashyapa, there is one description is there for Ojas, that is Pancharasa. Okay, Pancharasa is known as Oja according to Kashyapa. Then Garbha Poshana Hedu Nyaya. How the Garbha is getting the nutrition. So that is how it is explained by Kedara Kulya Nyaya. Okay, Kedara Kulya Nyaya means you can see paddy field are there, no? Paddy field where the rice is originating, paddy fields. You can see in the each paddy field there will be one particular water connection will be there. Okay, so one line of water connection will be going to every part of the paddy field, you can see. Okay, just they will be creating one water flow, and that water flow will be going to every paddy field will be there. So in the same way that every paddy field will be getting the proper nutrition. So in the same way Garbha Poshana is happening. So from the umbilical artery, umbilical vein, that umbilical cord is there, no? So through the umbilical cord the essence will be entering into the fetus, and it will spread all over the body, and through that way Garbha Poshana will be getting. Okay, so how the Garbha Poshana is happening, that is explained by Kedara Kulya Nyaya. We are making one water flow, and through that way every paddy fields are getting the proper nutrition. In the same way the Garbha Poshana is getting. Okay, so Garbha Poshana, how it is happening, that is explained by using Kedara Kulya Nyaya. Then according to Charaka, Urustamba is a Kapha Janya Vyadhi, and according to Sushruta, Urustamba is a Vada Janya Vyadhi. Okay, Urustamba according to Charaka Kapha Janya, according to Sushruta Vada Janya Vyadhi. Then Ambara Piyusha, that term is used for oxygen. Okay, for oxygen in Ayurveda we can call it as Ambara Piyusha. Then Andapudana Graha, that is description you can find in Sushruta. Gandha Pudana Graha description you can get in Yoga Ratnagara. Drishti Pudana Graha description you can get in Ashtanga Hridaya. Then in Somaroga, Kadali Grida is mentioned. Okay, in Somaroga for treatment, Kadali Grida is mentioned. That is told by Yoga Ratnagara. Okay, so Yoga Ratnagara has mentioned Kadali Grida we can give for Somaroga. Then Kuranda Roga, it is known as Vedana Rahida Andavriddhi. So there is enlargement of the painless enlargement of the testicle. That is called Kuranda Roga. Okay, painless enlargement of testicle is called as Kuranda Roga. Then Bilva Phala, Muli Kachi, Haritaki, Draksha. Okay, this the phala of these type of fruits. Okay, the fruit of these type of drugs should be used Shushka Avastha. In dry state you have to take it. Okay, Shushka Avastha mein lena chahiye. Like Bilva Phala, Muli Kachi, Haritaki Phala, Draksha Phala. These are all you should take in Shushka Avastha. In the dry state you have to take it. Then only that effect will be getting. Not the fresh one. So Shushka of Bilva Phala, Shushka of Muli Kachi, Shushka of Haritaki Phala, Shushka of Draksha Phala has to be used for the medicinal purpose. Then Nabhi Paka, Nabhi Kundala, this type of conditions are mentioned under Rasarakna Samuchaya. Then Harida Samhidane Ardha Chandranana Namaka Shastra ka Prayoga Mrida Garbha ke bahar nikale huye bahu ko kaat kar nikalne ke liye kiya gaya hai. So like in the Muda Garbha, sometimes the shoulder will get obstruct in the Yoni Pradesha. Okay, during the delivery, the shoulder will get obstruct the Yoni Pradesha, and because of that it will create obstructed labor. So in that condition, to remove the bahu, to remove the shoulder, you have to use one shastra that is called Ardha Chandranana. That type of shastra we have to use it for the removal of the bahu, and then you can remove the obstructed labor, Mrida Garbha from the Mrida Garbha means dead fetus. Okay, not obstructed labor, dead fetus. Okay, dead fetus is creating obstruction due to the shoulder. So by using Ardha Chandranana Shastra we can remove the shoulder, and then we can remove the Mrida Garbha from the uterus. Then Shirshambu Roga, so that is mentioned under Vaishyaja Ratnavali. So he has mentioned Shirshambu Roga. Then Chandana ke liye Malayaja Shabda ka prayoga Susruda ne kiya hai. So for Chandana, Susruda has mentioned the term Malayaja. Then Suji Karma Vyabhati, 4 types are there. Next one is Trina Panchamola benefit is Pitta Shamaga. Okay, Trina Panchamola benefit is Pitta Shamaga. Valli Panchamola, Kandaka Panchamola, both are Kapha Shamaga. Brihat Panchamola is Kapha Vada Shamaga. Leku Panchamola is Vada Pitta Shamaga. Dashamola is Tridosha Shamaga. Madhyama Panchamola is Kapha Vada Hara. Jivaniya Panchamola is Vada Pitta Shamaga. So sometimes they can ask the dosha, how the which doshas are reducing. Okay, next one is Varga they have mentioned, and which one is Sreshta among the Varga, and which one is not good, Ahida. Okay, Sreshta Hidagara Dravya, Sreshta Ahidagara Dravya. So in Shuga Dhanya, Rektashali is Sreshta, and Yavaga it is not, it is Ahida. Okay, so in Shuga Dhanya best is Rektashali and the worst is Yavaga. Shami Dhanya Mudga is the Hida and Masha is the Ahida. In Jala Varga, Andariksha Jala is good, Varsha Jala is not good. Then in the Lavana, Saindava Lavana is good, Ushara Lavana is not good for the body. Shaga Varga, Jivanti is the Sreshta, Ahida is Sarshapa Shaka. In Mriga Mamsa, Ena is Sreshta and Go Mamsa is Ahida. Okay, Go Mamsa is not good for the body. Go Kshira, Go Grida is good. Okay, Mriga Mamsa, Ena is the best variety. In Pakshi Mamsa, Lava is the good, Kana Kaboda is Ahida. Vileshaya Mamsa, that is Goda is the best variety, Bhega is Ahida. In Malsya, Rohida Malsya is Sreshta, Chilichima is Ahida. Then Grida Varga, Go Grida is good, Aviga Grida is Ahida. Kshira Varga, Go Dugda is good, Avik Kshira is Ahida. Stavara Sneha, Tila Taila is good, Kusumba Sneha is Ahida. Anuba Mriga Vasa, Varaha Vasa is good, Mahisha Vasa is Asreshta. Malsya Vasa, in the Chuluki Vasa is Hida, Kumbira Vasa is Ahida. Jalachara Pakshi Vasa, in that Paga Hamsa is Sreshta, Kaga Mudga is Ahida. Vishkira Vasa, in that Kukkuda Vasa is Sreshta, Chataka Vasa is Ahida. Shakhameda. So in that Ajameda is Sreshta, Hastimeda is Asreshta, Ahida. In Kanda, Sringavera is Sreshta, Aluga is Ahida. In Phala, Mrudviga, that is Draksha is Sreshta, Nikuja is Ahida. In Ikshu Vigara, Sharkara is Sreshta, Fanida is Ahida. So these are the good and the worst things of the each Varga. Then in the according to Bhava Pragasha, for Kanda, Surana is considered as a Sreshta. Okay, instead of Sringavera, Bhava Pragasha is telling Surana is the best one among the Kanda. Okay. Next one is Agryadravya, very very important. Okay, in every competitive examination, one of the question will be coming from the Agryadravya will be there. Okay, that is you have to by heart it. Vrittikaranam Anna, Sramaharanam Sura. Okay, Srama means like for relieving the fatigue, Sura is the best one. Okay, Brahmaniya Mamsa is the best variety. Hridyanam Amla, Vrishyanam Nakrareda. Vada Pitta Prashamanam Sarpi. Okay, they used to ask them which doshas are reducing. Vada Pitta. Pumsatu Ubhagada, that is done by Kshara. Ahridyanam Aviga Sarpi. Swapna Jananana Mahisha Kshira. So that's why those who are suffering with the insomnia, you can give Mahisha Kshira so they can get better sleep. Ashvasagaranam Udaka. Like a water, if you take it, you can feel little bit of like a pleasure, like you can feel there is some relief will be there. Ashvasagaranam Udaka. Jeevaniyanam Kshira. Okay. Tarpaniyanam Mamsarasa. Okay. Mamsa is Brahmana, Mamsarasa is Tarpana. Sleshma Belyanam Kukkuda. If you wanted to get Bella, you have to take Kukkuda. Sleshma Pritta Prashamanam Madhu, Vada Sleshma Prashamanam Taila, Akhandyanam Amakapitam, Anna Dravya Ruchikaranam Levana. Okay, if you wanted to get Ruji in the food particles, you can add Levana. Abhishandakaranam Mandhaka Dadi. Then Karshaniyanam Gaveduga Annam. Those who wanted to lose weight, you have to take Gaveduga Anna. Mutra Jananam Ikshu. Those who are suffering with the urinary problem, like those who are having urine retention or there is reduced urine production is there. In that case, you can give Ikshu. Okay, so it will helps to produce the urine. Vada Jananam Jambu. Sukha Virejanam Trivrit. Okay, Sukha Virejan is Trivrit. Krimiknanam Vidanga, Kushtaknanam Khadira. Okay, so Kushtakna is Khadira. Then Vayastabana Amlaki. Okay, so Kushtakna, that they have asked in the exam. So which one is Kushtakna? That is Khadira. Vayastabana is Amlaki. Then Vrishyavada Haranam Erandamulam. So Erandamula, it is both actions are there. It is helps in the Vrishya also. At the same time, it reduces Vada dosha. So Erandamula is Vrishyavada Haranam. Stambaniyanam Jala. Rasayananam Kshira Grida Abhyasa. If you wanted to get a Rasayana effect, you have to take daily milk and Grida. Okay, Kshira Grida Abhyasa. Then Shoshakaranam, Adis 3 Prasanga. Excessive sexual intercourse, it can lead to the Shosha. Okay, Shoshatva will be getting. Then Patyanam Prashamaha, Ayushyanam Brahmacharya. By following the Brahmacharya, you can get Ayus. Vrishyanam Sangalpa. Roga Vardhananam Vishada. Okay, depression, no? Like those who are suffering with depression, they used to get many disorder. Okay, so Vishada will lead to Roga Vardhana. Preenanam Harshana. Okay, Harsha is the Preena. Pushtigaranam Nivritti. Tandragaranam Adiswapna. Aharyanam Garbhashalya. So Garbhashalya, we have to remove it. Then Mrudu Bhesha Jiyanam Bala. Okay, for children, we have to give very mild dosage of medicines. Mrudu Bheshaja. Then Garbhadaranam Saumanasya. Those who are having the pleasant mind or those who don't have any other problems in the mind, they used to get Garbha. Okay, they will be conceiving properly. Visha Chigilsanam Ama. So in Visha Chigilsa, like Ama Dosha, for Ama Dosha we have to treat how the Visha will be treating. In the same way we have to treat for Ama Dosha. Dirgha Roga is Kushta. Okay, for a long time Kushta Roga will be there. Anushanginam Prameha. This is very important. Anushangi is Prameha. That is also you can see many question paper, you can see Anushangi, which is called for Prameha. Tandranam Basti. Aushadinam Soma. Ahida Desha is Anupa. Okay. Chigilsanganam Bishak. Kleshakaranam Laulya. निसंशयकराणां वैद्यसमूह, भयकराणाम् असमर्थता, अमृतानाम् आयुर्वेद, सुखानां सर्वसन्न्यास. Then virukshaniyanam uddalaka. Okay, virukshana, it will create dryness of the body. Uddalaka. Purisha jananam yava. Those who are suffering with the constipation, those who are not getting the stool formation, you can give yava. So through that way, stool formation, bulky stool will be forming. Amla pitta jananam kulatta. Mrudu virejana is chadurangula. Sukha virejana is trivrit. Mrudu virejana is chadurangula. Vishaknanam shirisha. Vadaharanam rasna. Okay, Vrishya Vadaharanam erandamulam. Only Vadahara, that is rasna. Patyanam haritaki. Prana saknya pradana hedu is vayu. Ahara gunanam tripti. Saumanasya jananam madhyam. Shandya garanam shukra vega nigraha. Okay, so it leads to Shandada. Sarva apatya is ayasa. Anayushyanam paradara abhigamana. Like parastri gamana, like other maidana with other ladies. Okay, that is create anayushyana. Avrishyanam is daurmanasya. Sramaharanam snana. Then shoshanam shoga. Okay. Then swapnakaranam pushti. Balakaranam sarvarasa abhyasa. Udaryanam ajirna. Yapyanam vriddha. Dushchigilsya sannipada. Sannipada disorders are very difficult to treat. Roganam jvara. Roga samuha is rajekshma. Okay, because in rajekshma so many disorders will be occurring. Roga samuha is rajekshma. Anushastranam sreshta is jaloka. Then bhuminam hima parvada is sreshta. Himalaya, that region is good for that is a good place. Arogya Deshanam Marubhumi. Okay, those who are having Arogya, like Jangala Pradesha, they used to have good Arogya. Ahida Desha is Anuba. Then Adura Guna is Nirdesha Garitam, like that patient. Okay, patient should have Nirdesha Garitam, like they should have that they should have that memory, like they should obey the order of the physicians. Then Varjyanam Nastika. So Nastika persons we have to avoid from our things. Then Varta Lakshanam Anirvedo Aushadina Vijnanam Buddhi Vardhana Tadvidya Sambhasha. Okay, how we can increase our intelligence by using the Tadvidya Sambhasha. Like we can think. Combined study. Okay, before exams we used to do combined study. No? So through the combined study we are remembering all the things. Okay, so that is Buddhi Vardhana. Okay, through the normal friendly discussion we can increase our knowledge. Then Anushtayanam Sadvajanam. Tikshna Virejana is Snuhi Kshira. Okay, Mrudu Virejana Chadurangula. Sukha Virejana Drivrit. Tikshna Virejana is Snuhi Kshira. Then Shiro Virejana. For that Pratyek Pushpa is the best one. Okay, Pratyek Pushpa otherwise known as Apamarga. Hikka Shvasa Kasa Parshva Shula Harana. Very very important. These type of things only they used to ask more time. Okay, like Pushkara Moola, it can it will reduce Hikka, Shvasa, Kasa, Parshva Shula. Okay, you can see because of the Shvasa and Kasa we used to get pain in the chest region. No? So those who are suffering with the Shvasa Roga and Kasa Roga, along with it they are getting pain in the this chest region, you can use Pushkara Moola. Okay, this is the way how you have to take the drugs. So Pushkara Moola, it is having the ability to reduce Hikka, Shvasa, Kasa, Parshva Shula. These four conditions will reduce by Pushkara Moola. So those who are suffering with the Hikka associated with the Parshva Shula, Shvasa associated with the Parshva Shula, Kasa, in these conditions you can choose Pushkara Moola. Sangrahi, Deepana, Pajana. These three karmas you can see in the Musta. Okay, so that's why in Adisara we used to give Musta Arishtam. So Deepaniya Sangrahi Sarvadosha Haranam is Ativisha. Okay, so it is Deepaniya Sangrahi and at the same time it reduces all the dosha, that is Ativisha. Vrishya Sarvadosha Haranam is Vidari Gandha. Okay, Vrishya Vadaharanam Erandamula, Vadaharanam Rasna, Vrishya Sarvadosha Haranam Vidari Gandha. Then Grahani Dosha, Shosha, Arshokna. These are all done by Kravyadi Mamsa. Then Vrishya Udavarta Haranam Samadadu Saktu Prashasta Abhyasa. Then anarogya karanam vega sandharana. By doing the vega dharana, it leads to anarogya. Sarva ahida is asad grahanam. Shastra adhigama hedu is acharya. Nisamshaya karanam drishta karmada. Daurbalya karanam ekarasa abhyasa. Grahani dushananam ajirna adhyashanam. This is very important. So grahani is getting vitiated due to the ajirna ahara adhyashana. Okay, excessive intake of ahara, it leads to grahani vitiation. Di, dridi, smriti, harana, madhyakshepa. Those who are drinking alcohol, they will lose the intelligence, they will lose the memory power. Okay, that all those things will be there. Nindida vyadi karana means viruddha virya ashana. Those who are taking viruddha ahara, we have to avoid that type of person. Okay, nindida vyadi karana means viruddha virya ashana. Alakshmi mukhanam rajasvala abhigamana. Then Vamana, Asthavana, Anuvasana Upayogi is Madana Phala. Very, very important. Okay. We always think Madana Phala is for Vamana Karma, but not for Vamana. For Basti Karma, best drug is Madana Phala. Okay. This is also important one. Then Anya Dravya Aruji Karana means Tinduga. Okay. Anya Dravya Aruji is Tinduga. Anya Dravya Ruji is Levana. Shoshakna Stanya Satmyagara Ajakshira for Shosha. Okay, like you can see, like children, they will not be having the proper weight, will not be there. For them, we can give Ajakshira. Okay, Shoshakna Stanya Satmyagara. So in case breast milk is not there, we can give goat's milk. Then Agni Vaishyamya is Abhishamashana. Okay, so these type of questions you can get. Agni Vaishyamya, Grahani Dushana. Okay. Because Agni Vaishyamya is done by Vishamashana, Grahani is getting vitiated by Ajirna Adhyashana. Then Tikshna Aushada, Vyayama, Vyavaya Varjana, that should be done for Garbhini. Okay, Garbhini, they should not take Tikshna Aushada, they should not do Vyayama, they should not do Vyavaya. Vyadi Karana Mithya Yoga. Because of the Mithya Yoga, we can get Vyadi. Okay, so these are the Agriya Dravya, very, very important. Any one of the thing will usually ask in the exams. Okay, next one is Kshaya Lakshana. This will see in the next class.